Namaste and good afternoon. I am Dr. Akriba Ahmed of Apollo Excelcare Hospitals, and today I'll be speaking about allergic rhinitis, which is a very common problem, and the diagnosis and the treatment of allergic rhinitis. Now, what do you mean by allergy? So I want to first tell you what is allergy. So allergy is a reaction to a foreign allergen. The immune system of our body, it reacts to foreign allergen, and then we have allergy. So allergy can affect any system of our body, any organ, any tissue of our body, but mainly it usually affects the skin and mucous membrane of the respiratory system and the gastrointestinal system. So there are a number of allergic diseases which are found, like asthma, allergic rhinitis, atopic dermatitis, and also anaphylaxis, food allergy, and drug allergy. So why is allergy so common nowadays? Actually, it has been said that this is because of lifestyle changes and also because of outdoor pollution. So allergy affecting the respiratory system is the most common form of allergy. So the nose, being the main door to the respiratory system, bears the brunt of allergic insult, and therefore allergic rhinitis is very commonly seen nowadays. So it has been seen that allergic rhinitis is prevalent in about 10% to 20% of the population, and in some cases it is even goes up to 40%. Now, what is allergic rhinitis? Allergic rhinitis is a non-infectious disease. So you don't have to worry that the person nearby, you'll infect the person nearby. It is not communicable. And another important thing about it is it is an immune reaction. So when there is a foreign particle or allergen which is exposed, by the patient is exposed to that foreign particle, then the body produces certain proteins. These proteins are called immunoglobulins, and in this case the immunoglobulin is immunoglobulin E. The immunoglobulin E will fight against the allergen, and in this course there are a lot of mediators which are produced. Chemical mediators are produced by certain cells of our body, such as mast cells, basophils, eosinophils, and these mediators, you must have heard about histamine. So histamine is produced, and in reaction to that, the person starts to sneeze, person starts to have rhinorrhea, nasal discharge, and this is called allergic rhinitis. অসমীয়াত আমি কওঁ যে ফুলৰ ৰেণু, যেনে পোলেন, ফুলৰ ৰেণু যেতিয়া আমি ধৰক আমাৰ এক্সপ'জাৰ হয় নাকত, তেতিয়া আমাৰ খুব হাঁচি আহে বা ধৰক খুব নাকৰ পানী লগা হয়। তো এলাৰ্জিক মানুহবোৰৰ এনেকুৱা ধৰণৰ চিমটমছ হোৱা যায়। So it are the causes of allergic rhinitis. Now, what is allergic rhinitis? So if you go to allergic diseases, there are complex genetic disorders which are susceptible to environmental triggers, and they are caused by many aeroallergens. Aeroallergens means allergens which are present in the air. So allergic rhinitis is triggered or caused by pollens from flowering plants, flowers of trees, weeds, grasses, and also the dander of cats and dogs, housefly mites, and moles. Then even you will be surprised to know that even insects like cockroaches, moths, mosquitoes, houseflies are also a source of aeroallergens. So it is not necessary that the person gets bitten by them. Even though the presence of the fecal matter or the dead bodies of insects, they disperse in the air and it forms an aeroallergen. Thereby it enters the nose and the person suffers from it. So I would like to mention here a very interesting fact about dust. The মানুহে কয় বা প্ৰায় কয় যে আমি ধূলি যেতিয়া পুৰণা আলমাৰি এটা চাফা কৰোঁ বা ধৰ পুৰণা ৰেক এখন চাফা কৰোঁ, ইমান হাঁচি আহে, হাঁচি ৰখাব পৰা নাই, মূৰৰ বিষ হৈ গৈছে, উশাহ লোৱা কষ্ট হৈছে, নাকৰ পানী ইমান ওলাইছে। Why does this happen actually? So corresponding to the age of house dust, the more old the house dust is, the more allergen the house dust becomes. So why is this so? This is because there is a viable, living, tiny creature in the dust called house dust mite. Dhulit ebit porijibi ase jak ami house dust mite buli kau. Ei house dust mite ধৰক ধুলি যেতিয়া আমাৰ উখা নলিত সোমায় house dust mite ধৰক saliva or fecal matter তেওঁলোকৰ dead body parts হেখিনি সোমাই পেলে আমাৰ allergency create কৰে. So what happens is the house dust mite, it multiplies a lot. It mates, it multiplies, and it is present throughout the year. It is perennial, it is there everywhere. So you need to be very careful that you are always cleaning your mattresses regularly. You are exposing them to sunlight. You have to be very careful about it. Now, what are the symptoms of allergic rhinitis? The sneezing is a very common complaint. So sneezing, once some people tell us that once they get up from bed, they sneeze for up to 20 to 30 times, and sometimes it goes on throughout the day and disturbs their social life. So sneezing is a very important complaint. Next is nasal discharge. The nasal discharge in allergic rhinitis is very clear and it is very watery. So much that the person, if it is of moderate, the person is having moderate symptoms, they have to use many hankies to clear their nasal discharges. Nakor pani to ekebare ponia hoy. Then nasal obstruction is another symptom. So patients initially they have a very mild nasal obstruction. Why nasal obstruction occurs? This is because when there is an allergic reaction, there is inflammation inside the nose. Inflammation causes obstruction of the nose. So sometimes the obstruction becomes very severe, so much that the person becomes a mouth breather. Now we have to be very cautious about children. So when children in their growing age becomes mouth breathers, then it might affect the contour of the growing face. Then these three are main complaints, and another important symptom is itching. So the person might say have itching of the eyes, nose, palate, throat, ears. So this is another complaint. So a person might have sneezing and nasal obstruction and itching, may not have much nasal discharge, or a person might have watery discharge and no sneezing but nasal obstruction and itching. So you might have 2 or 3 symptoms of these, and suppose you have these symptoms, you should come and get yourself treated. Now the next point, but what I'm about to tell you is very important, that how to identify these allergen triggers, means how do we diagnose allergic rhinitis. So why is this important? Because not all cases of sneezing or not all cases of nasal discharge is allergic. So patients come to us and tell us that I'm sneezing a lot, what is your complaint? When we ask them, they say, doctor, I'm having allergy. So they come with that complaint. They think that he or she is suffering from allergy, but that is not the case. So when we suspect allergic rhinitis from the symptoms, so we have to do certain tests. There are certain blood tests, and then there are certain skin prick tests which give us objective evidence of raised serum specific IgE. Serum specific IgE to an inhalant aeroallergen or an ingested aeroallergen. That means, for example, a person is allergic to house dust mite. So when we test for house dust mite in the blood, there are certain allergy panel tests. So when we test for house dust mite, the serum specific IgE against house dust mite will be positive in the blood test. And if we do a skin prick test and we test it, then we'll get a reaction which is positive for house dust mite. This is the way we come to know that a person is actually allergic. So in medical terms, we can say that the person is having allergic rhinitis. So patients bore koi je moi keteba bijolua bostu khabo bad dilu aru moi bole thanda bostu khabo bad dilu aru moi dhorok bengena khabo bad dilu tothapio mor ekon nakor pani nakor khojuti hoye ase মোৰ দেখোন এলাৰ্জিটো কমাই নাই মানে এনে বাট ইউ শুড নট বি ডুইং দিছ মানে এনেকুৱা খাদ্যৰ বাছ বিচাৰ একেবাৰে নকৰিব আনলেছ মানে যদি আপোনালোকৰ যেতিয়ালৈকে টেষ্ট নহয় এণ্ড ইউ আৰ নট কনফাৰ্ম ডেট ইউ আৰ হেভিং এলাৰ্জিক ৰাইনাইটিছ খাদ্যৰ বাছ বিচাৰ কৰা দৰকাৰ নাই কাৰণ this will affect your nourishment because the nutrition is very important in allergy. So another thing I would like to highlight is that allergic skin prick test, which I have been telling you that there are two types of tests, blood test and skin prick test. So in the allergic skin prick test is supposed to be the gold standard of testing for allergic patients. So allergic skin prick test can also diagnose other conditions like allergic conjunctivitis, asthma, urticaria. Urticaria is a skin condition. Anaphylaxis. Anaphylaxis is a severe allergic reactions patients might sometimes have to certain allergens. Then suspected food and drug allergy, atopic eczema. So in certain allergic conditions, it is very difficult to do a skin prick test, because the person's skin is very sensitive. Then we should go for the blood test. But when possible, one should confirm the allergy only with the skin prick test. Also, all skin conditions are not allergic. So if you have a skin condition, today I had a patient who came with a skin condition and said, I have allergies. So he thought I'm an allergy specialist, so why not come and consult me? But that is not the case because all skin conditions are not allergic. So you need to consult your skin doctor or dermatologist, and if your doctor thinks that you need to go for an allergic test, and only then you should come to an allergy specialist. So a skin prick test is a very reliable and very safe procedure. It is not that you will be pricking and you will be getting hurt. It is not like that. Tiny drops are given and only the epidermis of the skin is pricked, and a reaction if found will be positive for allergic rhinitis. So we are doing regularly in our hospital, and patients have been really benefited by this test. So in this test we test for the common allergens and also the allergens which the patients complain of. So SPT for house dust mites has been SPT means skin prick test for house dust mites are very common. আমি দেখা পাওঁ যে বেছিভাগ সময়ে টেষ্টটো ব্লাড টেষ্ট হওক বা স্কিন প্ৰিক টেষ্ট বেছিভাগ সময়ে হাউচ ডাষ্ট মাইট পজিটিভ আহে হাউচ ডাষ্ট মাইটে এলাৰ্জিক ৰাইনাইটিছ কৰা বেছিভাগ সময় দেখা যায়. So now the next point which I want to tell you is that why should we be concerned about allergic rhinitis? Why are we talking about allergic rhinitis? I mean, is it a very simple disease and it can be cured? So why are we talking so much about it? Because it affects our daily life and it can also lead to certain complications. So দৈনন্দিন জীৱনত এলাৰ্জিক ৰাইনাইটিছে বহুত প্ৰভাৱ পেলোৱা দেখা যায়. For example, in a daily life, a patient might complain of heaviness of head, or it might be sneezing and having nasal watery discharge which hampers his social activity. There might be decrease in smell. I want to tell you that the olfactory organ, the smell part, where the smell organ in our nose is in the upper level of our nose. So when we inhale and our nose is inflamed, the air that we inhale do not reach those receptors, and then we have a decreased sense of smell. So allergic rhinitis smell affect kore. And then there might be also nasal intonation. Nasal intonation, that means it is very difficult to pronounce the syllables M and N sometimes. Also the sinuses might get blocked. So we need to treat allergic rhinitis. And what are the complications which this might cause? So if you are not treating allergic rhinitis well, in children is a very common problem we get is glue ear. What is glue ear? Glue ear is fluid in the middle ear which gets organized. It results in decrease of hearing. So in glue ear, then there might be sinusitis, there might be inflammation of the sinuses, there might be pus in the sinuses, your sinuses might be blocked and might cause headache. Secondly, there might be polyps. So if the allergic inflammation increases, it is not treated, it is not corrected in an early stage, what happens? The reaction increases day by day and there might result in nasal polyposis. So in these conditions, say glue ear, then sinusitis, polyps, you might also need surgery, because polyps might obstruct your nose and then it is not getting treated with medications. You might need surgery. Glue ear might need surgery, and even sinusitis may need endoscopic sinus surgery. So another thing is loss of smell. So loss of smell may become complete anosmia, which we call in medical terms anosmia, and it indicates the disease is very severe. That means your nose is so much inflamed that no air is actually entering your nose. Another thing is it might also hamper your blood pressure. If you're not being able to inhale well, you're not being able to breathe properly, it affects your heart, it affects your blood pressure. So another important thing I want to tell you is that when an allergy goes downwards from your nose to your throat, then you might also have an inflammation of your voice box. This is laryngitis. Your voice might become hoarse. You might start coughing. If it goes further downwards, you might start coughing, because it will cause inflammation of your trachea. And further downwards, when it reaches your lungs, you might have bronchial asthma. So here I want to tell my viewers a very important thing, concept rather, of one airway, one disease. That is, allergic rhinitis and asthma are manifestations of one syndrome, that is called the chronic respiratory syndrome, chronic allergic respiratory syndrome. তাৰমানে allergic rhinitis আৰু asthma এটা syndrome কোৱা হৈছে, কাৰণ allergic rhinitis control নহলে পাছলৈ যেহেতু mucous membrane একে হয়, পাছলৈ bronchial asthma হোৱাৰ chance থাকে. So it is very important that we manage allergic rhinitis in an early stage. Now coming to the treatment part. So treatment can be divided into 4 parts: allergen avoidance, then environmental control, the medications, and immunotherapy. So when we talk about allergen avoidance, this can help to modify the course of disease. Means if you're having a moderate disease, if you are taking medications and you're also avoiding the allergens, the moderate disease might come to a milder form. So for example, for dust mites, you can encase your bedding in airtight allergen impermeable covers and wash it weekly in water at a temperatures of more than 55 degrees centigrade. You can replace your curtains with blinds, because curtains, they hold a lot of dust. And for animal dander is like dandruff type of skin of animals. For animal dander, you can wash your pets regularly, or you can also avoid furry pets. Another thing about dust mite is that you can use high pressure vacuum cleaning, and also you can wipe your tables and your furniture with wet cloth, so that there is no dust is not there in the air. For cockroaches is another important allergen. So you can seal the cracks of your walls, and safe pesticides should be used. So for fungus is a very important airway allergen. So fungus usually is called mold in common language. It thrives in a damp and dark environment. So allow sunshine to come into your houses. If you feel that your walls are moisture laden, do repair your walls, and try not to keep carpets in the patient's room, and the patient's room should not be very humid, should not have a high humidity. For pollen, one should be careful that in the pollen pollinating season and flowering season, one should not be keeping clothes and towels outside for a long time. Keep your windows and doors shut, and even in your cars, keep your window panes closed. So for medications of allergic rhinitis, medications for mild disease, the medications we use are antihistamines. Antihistamines in the form of tablets are available, in the form of sprays are available. One thing I want to make your viewers aware is that a lot of nasal drops are available in the market, which once you apply the drop, you feel it is your nose block improves. But these are not anti-allergic medications. Rather, if you use it for a longer time, what happens is that you might have a condition called rhinitis medicamentosa, and it is really disturbing, and it will cause more blockage of your nose. So for moderate to moderately severe disease, we usually give intranasal corticosteroids along with antihistamines, and they provide very good relief. But only thing is that it is not that you will take tablets or a intranasal spray for one day, you get relief and you stop it for the next 2-3 days, which usually everyone does. But you have to be very compliant. You have to take it regularly or, over the season, sometimes even for the whole year. Then specific allergen immunotherapy. So what is allergen immunotherapy? This is the only curative method of treatment of allergic rhinitis. So we do not give allergen immunotherapy in mild cases. Only for persistent diseases which do not respond well to medications, we advise that. Also the allergen has to be documented, we have to find allergen positive in skin prick tests or in the blood test, and then we decide whether immunotherapy can be instituted to the patient. And it is a long process, and a patient has to take it for many years. But it represents the curative and the specific method of treatment, and it can actually modify the course of the disease. There are two types of immunotherapy actually. There's a subcutaneous, which is given below the skin, and also a sublingual, you can give below the tongue. So sublingual is a very comfortable way of administration of the vaccine, and here the allergen vaccine is administered gradually in increasing quantities, and it reaches a dose which is effective in ameliorating the symptoms. So it is a long treatment. So lastly, I would like to emphasize that allergic rhinitis, unless it is mild, it should not be taken for granted. And one has to understand the disease, one has to accept the disease and take treatments according to your doctor's advice. I would also advise all my patients to do Jalniti. Jalniti is a form of nasal douching, because it increases the mucociliary function of the nose. Once you have a good function of your nose, we have a blanket of mucus in the nose which propels downwards from the nose to the throat. So if this function is impaired in any inflammation of the nose, and Jalniti will restore this function. It also helps in administration of the intranasal sprays. Also do regular physical activity, because obesity has been found to be associated with a lot of allergies, and take good nutritious food. So there are certain questions. So one question is that, can allergic skin prick test be done in young children? The question is by Rumi Deka. This is a very good question. Yes, it can be done in young children. We usually, it can be done in children above 2 years, but here we do only above 5 years. It can be done in young children. The second question is, what causes allergic rhinitis? By Abhishek Das. The allergic rhinitis, as I said, it is a complex genetic condition, and if one is exposed to those environmental triggers, it causes, and there are a lot of aeroallergens. I already spoke about it. Will intranasal steroids cause diabetes or any other side effect? The question has been asked by Kasturi Mahanta. Yes, this is another very quick question. No, intranasal steroids do not cause diabetes, because when we are spraying inside the nose, very tiny amount, we call it bioavailability of the steroid spray, very little amount enters the bloodstream, and studies have been done for many years, and it shows that it does not cause any harm to the body, does not cause diabetes. So it is very safe. Even in pregnancy, I want to emphasize, even in pregnancy you can take intranasal steroid sprays. Why is allergic rhinitis very common nowadays? This question asked by Dibakar De. Yes, it is very common nowadays, mainly because more people are more staying indoors. Children are more used to video games, and children are more used to television. They are mostly staying indoors than going outdoors. So what happens is that children get sensitized to the perennial indoor allergens, the allergens which are inside the house. Children get sensitized to it. One more thing is that the hygiene. We parents have the tendency to clean the house, to sanitize the house. So allow your children to grow in a very normal environment. Do not allow them to grow in a hospital type environment. So they have to be exposed from the infancy onwards to the normal microbes which are present in our environment. So what food items are needed to be avoided? So Vamita Das has asked this questions. As I already mentioned in my talk, that you need not avoid food items unless it is proven by the test, by the allergic test, that you are allergic to the certain food. Suppose skin prick test we find that you are allergic to egg white, then you might avoid egg white, but unless it is proven, you should not avoid any food. So is surgery needed for allergic rhinitis? This question has been asked by Chinmoy Mahanta. Is surgery needed for allergic rhinitis? Yes. Sometimes surgery is needed for complications of allergic rhinitis, say sinusitis or say nasal polyps, then surgery is needed, or a mild deviation of the septum. Deviation of the septum might increase the nasal blockage, and then when you spray, you deliver the intranasal sprays, it does not reach your nose. Then you might have to do a surgery for proper delivery of your medications. Or for nasal polyposis, if it causes obstruction, then you might have to do surgery. So any other questions there? Much. Okay, so I think we've come to the end of this thing, and then I would like to say that treat your allergy, smile, breathe, be positive, and live a happy life. Thank you. Namaste.